new immersive platform for medical education. We're super excited. Medical talks every Thursday evening at 7 p.m. We use cutting edge VR technology to deliver these medical talks. We're super excited today. It's a little bit different than our typical talk. It's way less technical. Dr. Gaddis is going to introduce our speaker in just a minute. He's doing some really cool things out in the community, and he's going to share some of that stuff with us today. We just asked, as Dr. Gaddis mentioned, if you guys can just keep yourselves on mute during the conversation, during the talk, and then towards the end, we'll have a conversation where we'll unmute people and have a little Q&A session and everything like that, so everyone will have an opportunity to talk. Also, just basic etiquette, as if you're at a movie theater, Alexa will go jumping in front of the screen like this and doing a little dance while Ty's speaking. But if you really want, Dr.
All right, thanks, Dr. I'll introduce Tyden today. I met him very serendipitously as I was getting my shoulder treated with orthobiologics, and he was administering a shockwave therapy to me. And I started talking, and I discovered that he's super talented and way ahead of the curve in terms of what people and in his level of careerdom is doing right now. So Kaiden recently graduated from University of South Florida with a degree in English, and he's on the pre-medical track. Currently, he's working as a medical assistant at Regenexx of Tampa Bay, working within the non-surgical orthopedic care. He's actually an immigrant to the U.S., moving from the United Kingdom in 2010, and is a first-generation college student. He's an award-winning student leader, published author, athlete, and, of course, aspiring medical student whose passion lies within sports medicine and healthcare activism. Throughout his undergraduate years, Kaiden was president of 3 major organizations and even founding one of his own that he has since helped spread to every major public university in the state of Florida. And that's what he's going to be with us out today. So without further ado, welcome Mr. Kaiden Payne. The stage is yours.
Thank you, Dr. Gaddis, and thank you, Dr. Omar. You're way too kind, but yeah, I'm very, very happy to be here today. I'm happy to be talking about this topic. I feel like it's something that's kind of glanced over in healthcare, and especially at the undergrad level, and that's primarily where my talk stem from. Is I don't really have experience in the and that's going to be a main theme for tonight. Real true health kind of education. Education can really help my develop. You can really mentor people through education. Us all and a real motif for tonight. And there's a discussion at the end, because I'm hoping that with some doctors here or some medical students here, or anyone else from any sort of healthcare profession can provide their outlook and their perspective on this matter as well. So the title of my presentation today is Medicine as a Team Sport, Deconstructing Ego in Healthcare. I've always been a big sports fan. I've played sports all throughout my life. It's been one of those things that has kind of kept me sane at times. It's kept me stress-free. I've tried every sport you can imagine, only been pretty good at a few of them. But it's been one of those things that I've really enjoyed. And so I'm hoping that I can combine my passions of medicine and helping people in healthcare with that by going into something like sports med. I currently work, like Dr. Gaddis said, where they do stuff, which is really cool to see, especially for recovery time. Is much shorter than traditional surgical techniques, and so I've been able to get some great experience as a medical assistant, seeing athletes get better quicker using their own bodies healing properties. So moving forward, this is really where everything started for me. I started this organization called OAM, or the Orthopedics and Athletic Medicine Club. It was my junior year of college, and I'd already been president of 2 organizations, and to be honest, I was kind of tired. I was getting ready to start gearing up for the MCAT, take some of the more rigorous science classes, and I said to myself, I think it's time just to join an organization and just kind of reap the benefits of being a regular member, let other people do the hard work of planning events and stuff. And so I looked on our school's kind of main hub and tried finding something related to sports medicine. And funny enough, there was nothing. There was no organization at USF that had something to do with sports medicine or orthopedics or anything at the undergraduate level. I saw that kind of as a sign to create something for myself, something that I could be proud of, something I could leave as a legacy to the university, and then something that eventually spread to Florida. And so that was something that I created as a form of bringing people together, true collaboration. At university levels and at maybe medical school levels, there's a lot of different organizations related to specific niche things. You have students that are in the pre-PA club, or you have students that are in the pre-PT club, or students that are kind of isolating themselves, but there's nothing to bring people together, especially students. And there's no more collaborative thing than sports medicine, especially when it comes to bringing people together with similar passions, similar outlooks on healthcare. So what I wanted to do, create something that was accessible and something that we could, have everyone join in together. So I was playing around on Canva and came across this, these two elements and created this logo, which is now kind of synonymous across campus. You see this logo and you think of OAM. But the first question that got me thinking when creating this logo was, why is there an I or a me in medicine? A lot of times shadowing, the healthcare provider that I was shadowing would ask about who else I was shadowing. And it would almost be like a question that had attached to getting from. They don't know what they're talking about. You should just stick with me. I had one instance where I was shadowing an orthopedic surgeon, and I told him I had shadowed a podiatrist in the past, and he just straight up told me, well, they don't know what they're talking about, so don't listen to them. We never tell people to see a podiatrist because they don't have the same level of education that we orthopedic surgeons have. And I was just like, wow, that's such a jaded response. It might be for you that you have that, but when you think about it, these are because we're not collaborating with people all the time. You kind of sit in your niche with whoever you might be with, and you don't kind of widen your experiences. And so on the flip side of that, I've met a ton of orthopedic surgeons who have been more than happy to recommend podiatrists. And although there might be, it got me thinking about, why is there this inherent ego? Why do we have things in place? Certain healthcare providers think they're above others just because of a title or a degree. We should be working together. We should be putting the patient first. I might have as a provider might not do you good, so maybe I could send you somewhere else to give you more options for better healthcare. So the big thing for me was, what can I do at this point as an undergraduate student? And so going back to starting OAM, it was, how can I educate people at a undergraduate point to really spur them on? And how can I bring people together as a freshman or a sophomore or even a junior, and we can collaborate together? So I thought of, my experiences before leading organizations and what I really loved about leading those organizations and being a part of them and what they entailed. And I was president of the USF chapter medical fraternity. And what I loved about that was the program working and the seminars that they were able to bring us. But, there was a financial element. There were dues that we had to share to be a part of this organization. Not crazy expensive like other more traditional fraternities or sororities, but still an expense that some people might not have to spare. And so when you think of this sense of community, you want something to be completely open and accessible for everyone to enjoy if they want. So my immediate thought was, this has to be a free thing. We can't have dues. There could be kids who are working 2-3 jobs to put themselves through college or, saving up for medical school. So we want to make sure that this thing, when it becomes real, hard from because of financial restrictions. The other thing was accessibility when it comes to attending. Another thing was running these organizations in the past. There was point requirements in order to remain a member. That keeps people accountable, having things as a resume builder. But for me, it got me thinking students didn't have the opportunity to be at every single, or maybe 75% of events, because they were studying for the MCAT, or maybe they were family members that weren't doing so well. And so I wanted to create something that was almost like a buffet. It was like a programming buffet where have something planned or programmed, an event, a seminar, whatever it is. You don't have to co-opt people attending just because of a point system, or it should be the fact that if people want to come to something, it's on their own volition because they want to learn, they want to take advantage of an opportunity. So that was the next kind of main thing I wanted to include. So from then as active members, per se. And then the last thing was having it completely open to anyone to join. A lot of these organizations, there are rush processes or there are barriers to entry. And within medicine, there are a lot of barriers to entry. As a medical student trying to get in already the MCAT, there's the trials and tribulations, getting accepted, and everything that comes with that. It's very difficult and it can deter people. I wanted to make this organization could join, very so turned away from the idea of going into medicine, sports medicine, orthopedics, whatever it may be. Resume, or making their resume as polished as possible for those internships or whatever would progress their undergraduate career further. So we had a great deal of events related to education, and I think that was fantastic in the kind of becoming of what OAM was standing on. Going on to the next slide here, philanthropy is another huge part of what we do at OAM and what we continue to do. About 3 weeks into kind of figuring out what OAM was going to be, what we stood for, and what we wanted to do, I'd remembered a time I had in high school while volunteering with a Special Olympics team. And I was the head coach for it was an under-8s soccer team with Special Olympics. And if you are unaware of what Special Olympics is, it's a non-profit. It's worldwide. It's global, and it allows for those with intellectual and physical disabilities the ability to play sports and feel included in a team at free, at no cost associated for this for athletes and families. And this was a really powerful message for me to think of, because this tied into exactly what I wanted to do with OAM at a different level. It was inclusive. It kind of provoked this idea of collaboration, non-discrimination, and this idea that we are not the only people in the world. There's so much we can do to be helping the community. So 3 weeks after kind of creating the basis of OAM, I reached out to a regional director, and we had a big board meeting as far as outlining a possible partnership, and I was able to secure that within the first month. And so what we've been able to do is volunteer at all of the local events, all of the regional events, and most importantly, raise money for the athletes so they don't have to worry about paying for equipment or referees or tournament costs at all at a local level. I'm in the Hillsborough County area, so all of the money that we raised at USF went to Hillsborough County athletes. And so keeping it local was really powerful for me, because we saw the athletes, we interacted with the athletes on a weekly basis, the ones that we were raising money for. And so, you'd see the brand new flags that were bought and used, or you'd see the new footballs or the gloves or whatever it was that the athletes are taking advantage of, because we're, working hard to fundraise for them. And it's, it's a very powerful feeling. And also tying into the medical aspect, these athletes at regional competitions, they get free health screenings where local doctors will come in and provide free screenings for athletes to make sure that they're not having anything wrong with them, and that they're getting the right medical attention that they deserve and they need. Unfortunately, there are healthcare professionals out there that overlook the disabled, which is a very unfortunate thing. So these healthcare professionals that come in and volunteer for these screenings are absolute godsends, because they catch a lot of things that other people wouldn't. At the most recent USA Games, which was held in Orlando, this summer, I was able to volunteer at one of the screenings, and it was found, the statistics was that 70% of the athletes there were wearing shoe sizes that were either too small or too big for them, and they had no idea. Because they wouldn't get regularly checked up, they wouldn't it wouldn't really be an important part to them making sure that they have the correct footwear. And a lot of issues come with, wearing the right amount of footwear, and a lot of issues related to the feet stem from that. And so we're able to, make sure that the athletes were really getting the attention, the medical attention they need to serve. So we're able to, as an organization, kind of partner with them and make sure that they are doing great things. The last pillar here, teamwork, is again what kind of connects this all together. But it's interprofessional team building skills through sports, socials, and other activities. So we also wanted to make OAM a social club as much as, bring people together, and, people that are interested in sports. There's no better way to do that than through sports socials. So, we held basketball socials and ultimate frisbee socials and beach volleyball socials, where our members could come together and interact, especially in a post-COVID world where interaction wasn't, the best thing in 2020 and 2021. We're able to really come together and, speak as human beings. And there's nothing that brings people together more than sports. You can find some common ground there and really fight to have fun. These pictures here, we had an intramural competition team here for flag football. That was a ton of fun to be a part of. And then here we were partnered with Special Olympics in their Sunshine Bowl, which was held at Raymond James Stadium, which is a flag football competition. We ended up placing third in this, which was great for being our first tournament. And it was just a ton of fun just to meet people and hang out. And everyone said that, they would never have done this or had the ability otherwise. And so that's the teamwork aspect of the organization. So all three of these pillars really connect, and they make for a really well-rounded organization. And so the next thing for me naturally was how can I grow this organization? This is to go, or this week for FSU, where their chapters are kind of growing and their teams are working together about planning the semester. So even though I'm not with USF anymore, I still kind of hold a position with making sure that these chapters are doing well, they are growing, and they're doing the right things, and mainly, keeping the pillars of what the organization was built on. Open accessibility, free to join, etc. So I want to make sure that, as I told Dr. Gattis the other day, that grandma's soup isn't being diluted. It's grandma's soup in Tampa is grandma's soup in Gainesville. We don't want that recipe to be changed, because at the end of the day, it's the identity that matters. So these are just some quick numbers. We have over 700 members statewide in all 5 chapters. Which is a huge number for just being, over a year old. And I'm really, really proud to say that, I've made a ton of friends that I wouldn't have made along the way. Another huge success is that we've raised over $20,000 in our first year for Special Olympics through locally ran events. We put on massive tournaments that really brought in the local Tampa community, where we could, raise money. And in the end, we raised over $20,000, which helped out a ton of athletes in our local areas, and then the other areas of chapters that were raising money as well. And then 54 individual events were programmed between August and May, which is a huge number for our programming diversity, why people, wanted to be a part of OAM at their respective chapters. And so I'm really proud of that number there. And then at USF chapter, we actually won 3 awards at the university level, one of which for the programming aspect. We ran a spikeball tournament that attracted people from all over the state to come and compete, and we raised over $4,000 in just that one-day event. We had local vendors, we included local businesses. We were able to secure partnerships with Celsius Energy and Bang Energy. Publix was able to sponsor the event, and so we won an event for running that, and then won an award for running that event. And then we also won the best new student organization at USF for last year, which is a huge achievement coming in and showing that, we're here to do great things, and we're here to stick around as a part of USF for time to come. This is moving on to, I guess you could say, the second part of my presentation, which was more about the coming together as healthcare providers from all different fields and working together for the patient. And this is by the World Health Organization, and it's in the context of a complex healthcare system. Effective teamwork is essential for patient safety as it minimizes adverse events caused by miscommunication with others, caring for the patient, and misunderstandings of roles and responsibilities. And this is a huge thing. At Regenexx, one of our values is patient above all, which resonates with me a lot, because it should be the patient is put first. It doesn't matter what your beliefs are as a provider. It doesn't matter how much money you do or you don't make in profit. It should be that whatever's best for the patient should come first, and that should be prioritized. And if working with other people within your team and effective communication is going to get the patient the best outcome, then that should be the action that's taken. So a few things for at least me to know, and this is why I want to open up for discussion, because I can only speak on my experience. I can't speak on experience of working in a hospital because I haven't, working at medical school because I haven't got there yet. But a few things I've noticed, at least as a medical assistant and within an undergraduate level, is appreciation and respect across specialties and providers, regardless of level, has been a huge thing. Doctors that think they're above nurses, or nurses that think they're above other providers, or PAs that don't get the respect that they deserve when it comes to treating patients. This is something that should be no question. It shouldn't be a case of I have a bigger title than you, I went to more schooling, so that way your opinion doesn't matter. It should be how can I learn from you? How can we work together to make sure the patient has the best outcome or the greatest success? And that leads into the second point, patient-centric approach to healthcare. How can I be working with other people to make sure that the patient is going to do the best? And then where do conflicts of interest arise? And a huge thing for this is profit. I come from England, where healthcare is universal. It's not privatized. It's funded by the government. So there is really no conflict for interest when it comes to that. But here in the United States, it is a private system. Hospitals are ran by administrations who, at the end of the day, are trying to make money. And so conflicts of interest do arise when patients are seen more as cash cows than human beings who need help. And so these conflicts, when it comes to not wanting to collaborate with others, is, will I lose money? Will I lose a patient? When it shouldn't be like that. It should be, I'm going to refer you to this other person because I can't do much to help you. I'm not going to prescribe you this medication, or I'm not going to try and do this treatment on you because in reality, I know it's not going to work, but at least I can build the insurance. That shouldn't be the mentality. And then just as a sports team analogy, it's, you're on the same team, especially you're all working together to make sure that the patient is going to recover as fast and as best as possible. And so you're all, aiming at the same goal. There's always that one player, it seems like, on a team that wants to dribble around everyone and not pass and try and score the goals all for themselves. But, for me, at least as a midfielder, I prefer the assist over a goal any day. So this is where the open discussion comes in, and I'd love to hear from anyone that would want to speak on this topic. I think it's great to hear from different perspectives. The first question is, have you ever experienced a time where effective teamwork within your field has been pivotal to a patient's outcome? Does anyone that wants
what
to
I'm
speak
going
on
to do
that?
is I'm going to start requesting to unmute people. So as if you guys have any questions or any input, and if you can chime in on what Kaiden is asking, that'd be great. Let me see here. Oh, we have a pretty big list. So if anyone wants to chime in, go ahead and just select unmute there. In the meantime, I can definitely chime in. So have I experienced a time where effective teamwork within my field has been pivotal to a patient's outcome? Absolutely. So I did my adult neurology residency here locally in Tampa. Well, I shouldn't say here, we're in the metaverse, but in Tampa at the University of South Florida. And, being a neurology resident meant that we had quite a broad spectrum of consults, anything from, just run-of-the-mill stuff that would come through the emergency department, transplant patients, patients in the ICU, neurosurgical patients, a lot of IM, epilepsy. So there was a lot of it's actually one of the reasons why I went into neurology, is because the nervous system permeates every part of our body. And so, yeah, we had a very diverse kind of experience. And through it, I would have to work with a lot of different specialties. I will admit some specialties had certain personalities that were easier to navigate than others. But hey, one thing that stood out to me was there was this thing called Miller-Fisher testing, where it's a procedure that's used to tease out the diagnosis of what's called normal pressure hydrocephalus, which is basically an imbalance in the ratio of fluid to brain matter inside the skull that would manifest as, cognitive impairment, gait impairment, and then urinary incontinence. The saying we would always say is wet, wacky, wobbly. And the way we would assess that is 3 ways. We would have to perform like a small cognitive assessment. Then we would have to perform a gait, like a timed get up and go gait test. And then we would have to perform a lumbar puncture, take off a high volume of fluid, and then perform all that again. And as you can imagine, when you have a busy consult service with, one resident following 50 patients, you don't really have time to do all those things. So we would have to collaborate, we would have to reach out to our psychiatry colleagues to perform this cognitive bedside assessment. And then I would have to coordinate with physical therapists to come do this, timed walking test, after which I would perform a lumbar puncture and send the fluid down for analysis. And then within 10 minutes, the physical therapist would have to come and redo that walking assessment. And then within another 10 minutes, the psychiatry residents had to come and do this bedside cognitive eval. And as you can imagine, that was kind of complicated to coordinate in the middle of a busy day where everybody's got a million things going on, and there's stroke alerts and trauma alerts and Baker Acts and all this crazy stuff. So I think at first it was a frustrating thing, but once you started to build a relationship with these colleagues, it became something that I looked forward to, because it was like, hey, we have, this fun thing we're going to do as a team, and it worked out pretty well. So I distinctly remember that as like a very concrete collaboration I had to do on a daily basis.
Yeah, that's fantastic. It's a great example of how people can come together for one cause, even in like the hectic mess of running around and everyone doing their own things and external things coming in. It's like, we're a team. We can, with effective communication and direct roles, we can make things happen. And so I'm definitely happy to hear that that was something that you had a positive experience with. Is there anyone else that wants to talk on that before we move on to the second question?
I'm trying to unmute. If anybody has like a story they want to share. It doesn't even have to be medicine. It can be outside of medicine. I know a number of our audience members here are just kind of stumbling into the stage. If there's anything that you could share, you raise a hand or clap or something, and I know to unmute you. I think no. How about you, Dr. Omar? I know you got something.
Yeah. So actually, listening to what you were saying made me realize that when it comes to acute medicine, acute care, we really don't even have a choice. I'm an interventional pain physician, but I'm also an anesthesiologist, and I was up in Boston for my residency at BU, and at Boston Medical Center is a safety net hospital right in the heart of Boston. So we saw a lot of very acute medicine, right? So whether it was trauma, but one thing that really sticks out to me that I, had to deal with more than once was something called a code surgical airway, right? A surgical airway emergency. And so as an anesthesiology resident, it could be 2 a.m. and I'm in my call room or wherever I am in the hospital doing what I'm doing. And hey man. And so and then over the loudspeakers you'll hear something called surgical airway emergency, and it'll be called out on the loudspeaker 3 times. And within literally seconds, under a minute, there are members of different specialties, different teams throughout the hospital who congregate to try to figure out a very acute issue, which is someone essentially is unable to breathe and could die within 3 minutes. 3 minutes, a hypoxic brain, 3 minutes, and that's pretty much it, right? So I would find myself either sprinting to the ED or to the ICU, and I'm met there by trauma surgeons, I'm met there by ED physicians, I'm met there by ENT, various nursing teams, respiratory therapy, and everyone congregates within minutes or even seconds sometimes. We have to get our brains together, make a decision, take action, and save a patient's life. And so when you incorporate the factor of we don't have time to think about ourselves, you realize that, inherently we all really are trying to do the right thing. Right. And, Kaiden, you bring up some good points. Is that sometimes all these external factors, whether it's insurance or this, that, or running the business or, some sort of alternative, distract us from what's really important. So it's, I love that you're bringing this up today. This is awesome.
Yeah, I'm definitely happy, and I appreciate the story that pretty much goes hand in hand with, being able to pull people from different fields of thought, and then within seconds having to come together and kind of achieve greatness in order to save someone's life is a very, a powerful adaptation of what we're trying to build at a grassroots level and undergraduate level, so that when it comes to that, when people, maybe members of OAM in the future, when they are part of these different teams that come together, it's not going to be a learning curve for them. It's okay. I spent 4 years with this organization working with all these different people. I can do this. This is quick, and more lives are saved. It's something that has that butterfly effect opportunity.
If I may add, I think this kind of like separation exists on so many different orders of magnitude. I mean, you have between like medical doctors and then scientific doctors like PhD, there's so much, I obviously I work alongside PhDs, but if you really ask me, do I know everything that they know? What do they do what's their day to day, and like what's their workload and their expertise and all these things? Like I might not know, right. Even there's even rivalries. So I went to an osteopathic medical school. Not only was there maybe traditionally some rivalry between MD and DO, but even within a DO school, there are some DO students who just look down on being a DO, and it's like, well, where does this come from? Is this coming from like low self-esteem or something?
Yeah, and
who knows? So
it's hard to pinpoint where it's coming from, for sure.
Yeah.
So for the second question, I don't know if either of you have something to add on this either, but this is more on the negative end of it. But has anyone ever encountered a time where a provider in your unit has been looked down upon, undervalued, or overlooked simply because of their title? And then what was your initial reaction to that? Because I feel like this happens a lot, or at least I've been told. And there's also a lot of different reactions initially that can kind of stem from that. So anyone want to speak on this?
I'm sending out requests to unmute. Feel free to chime in, folks.
I'll chime in here. So my name is Nevin Steinmetz, and I also work at Regenexx, not the same one that Kaiden does, one in Colorado. And unfortunately, I've had this experience or observed this experience where some physicians, not what you've described, where, we should be working all together and respecting everyone equally, but do value themselves more. And it's unfortunate because I think it does end up affecting the patient because, unless a patient is under sedation, they're in that room, they're receiving the treatment, and the energy in the room changes as well as the dynamics of the teamwork. And so it then doesn't become really teamwork. Like you said, the analogy of on the basketball court, if someone's trying to do all the dribbling themselves, unless you're really a superstar, it's going to be hard for the team to score unless everyone is working together as a team. And you get buy-in from your staff, when you treat them well and you respect them and you show them respect. And so what I've observed, I'm not a physician, I'm a PhD doctor. So when I observe all of these behaviors and interactions, you get buy-in from your staff when you show them respect, which seems like a no-brainer, but it doesn't always work that way. And some of the smartest people don't recognize that it is a no-brainer. So, yeah.
Yeah. No, and thank you, Nevin, and it's happy to hear someone from the Regenexx family all the way in Colorado. So, but yeah, thank you for sharing that. And it's unfortunate that these things do happen. And hopefully with more, people speaking about this topic, we can kind of promote an environment or a community that is kind of against this way of thinking. And we kind of promote something that is way more positive and way more inclusive, and allowing those that are in the room who have obviously, if they're in the room, they are deserved of a space in that room, a place to have their opinion not only listened to, but respected. And like you said, it's, it can really change the dynamic, and that's not fair on the patient. It should be that the patient in there has a quality experience where they feel like the people who are taking care of them and their entire bodies are in these effective strangers' hands, are doing the best to work together, and the peace is held. So I'm definitely with you on that.
Yeah.
Go ahead, Nevin, go ahead.
I was just going to say, the example that I'm providing is, quality of life-based care. People are choosing to receive a procedure opposite of what Dr. Omar described, which is, an emergency situation. But in either of the situations, it's a team of people providing the care. Very rarely is one person, unless it's, if someone comes up on someone and they are doing CPR or something like that. But typically it's a team of people providing care, and you need everyone in the team to provide the care. And so it's, although someone may be the physician and someone may be, a radiology technician or each person has their role, they're still part of the team. And so
100%. Yeah. 100%.
If I may play the devil's advocate for a little bit here, I will be the first to admit that I've been that bad guy sometimes where I'm like, oh, what does this person know? How could they consult me on this? Like, this is so silly. For instance, on those 24-hour calls when it's like 3 a.m, you've just run 4 stroke alerts, and you get a consult out of the emergency department for pinky toe numbness. The emotional reaction is like, oh my gosh, like, who cares about pinky toe numbness? Why are they bothering me about this guy's pinky toe and so on?
Right.
And I remember feeling very flustered all the time with that until I had somewhere in the middle of my second year, I had kind of like an aha moment. And I realized, I'm like, this guy who's consulting me is, he has a million other things going on, right? He's out there, intubating somebody, dealing with somebody who's got bowel obstruction and this and that and stuff that I have no clue about and I would hate to have to deal with. And so when a neurologic patient, it was definitely, we'll save that for another time. I realized, you know what, this guy, thank God he has me to come down, and vice versa. Like if I had a patient who, I'm seeing for epilepsy, and all of a sudden the person's clutching his abdomen and is freaking out, I'm going to reach out for that, that GI doc or that internal medicine doc. And, I'm going to thank the stars for their expertise. So it's almost like just a shift of perspective. The other thing is that, well, sometimes I feel like it's frequently, or maybe even too frequently, perceived as ego, as much as it is just being overwhelmed, stressed, not having enough time. When I send patients to physical therapy and I get this, a couple days later, I get this form in my inbox that is outlining the physical therapist's, plan. I maybe have 10 seconds to look through that thing, recall who that patient was, remember what their physical exam was. And oftentimes I'm just so happy that the person is seeing a physical therapist that I just sign off on it. And I hate to admit it, but it's true. And I feel like I'm not the only one,
Right.
I wish that there was definitely more time. If we had more time, I'm sure that the vast majority of
physicians and healthcare providers would love to like deep dive a little bit more into what else is going on. So I think that is a huge thing. And unfortunately, that's like a deep systemic problem. That's
Right.
going to be more than just, patting each other on the back.
Right.
I love
Yeah,
that you
no.
brought that up, Jansen.
Yeah,
I think it's very true.
I
I
think-
mean, go ahead, Patty.
No, go ahead.
No, it makes you realize that it's not that there's just some bad apples amongst us. We're all sort of susceptible to this because of the demand that the system has on us. So you can be the greatest person. You could be future Kaiden Payne, be really stressed out and
100%.
really have to be very self-aware and resist and be very, very introspective, take a deep breath in order to not in order to not end up doing something like this, right? So we are all susceptible to it, and it's something that we have to not just work on within ourselves, but advocating within the system. Things like wellness and work hours and all of these things really do play a role in this becoming a systemic problem.
Yeah, 100%. And that's not to say that, we are all perfect beings or we're going to live a career that's entirely perfect and we never upset anyone or disrespect anyone's feelings. Like, there are going to be times where that happens. I think the question becomes, how often is that happening in your day-to-day career or your workplace? Because if it's happening, more than once in a blue moon because you are overstressed, you are overworked, or there's hectic things going on, it might be, different reasons where that's stemming from. And a big thing that Dr. Gattis brought up that I'm really glad he brought up was this level of this epiphany was related to a completely unearthed level of empathy, I think, related to, I don't know what the other person is going through. I'm not him. I'm not her. I'm just happy that I can provide my knowledge, my expertise to put their mind at ease. It might not be the best thing in the world at 3 a.m. when you're having a consult, pinky toe with tingling, but it might be the end of the person giving the consult, or if it's the first year intern that's giving the consult who's like, will this derail my career? If I don't consult on this pinky toe, will this person, be paralyzed for the rest of their life? There's these things that you can think about and say, maybe I am, helping out by just, not being overly aggressive about having a consult, this said pinky toe. So I think that's huge. The empathy thing is really big, being able to put yourself in someone else's shoes and really ask yourself, okay, if I was in their spot, what would I be doing? And sometimes it's going to be one of those calls where it's like, why are you even asking me this? This is kind of silly. But most of the time I think it'd be put to, being overly cautious, and then just a perfect storm of also having the person you're calling be super busy. So, but I think it's how you respond to that. You can change only what you do. You can't really affect any of the external circumstances. And so if you can be in control of how you approach a situation or how you deal with something, I think that really goes a long way with making that person not feel like they made a mistake, or maybe they shouldn't ever consult at 3 a.m. ever again, because, at one point it could be life or death, right? Does anyone else have anything to say on the same before we inevitably move on? Okay.
If you have any pinky toe numbness, let me know.
Yeah, let Dr. Gattis know. He can help you out. And so this is pretty much the end of my presentation, and I think this is something that does get overlooked sometimes. We are all human beings with human feelings, and it's very easy to have your feelings hurt. I think sometimes that can happen maybe unintentionally, through the stress or the heat of the moment. But I think it's important to remember that every member of a healthcare team has a valuable role to play, and they shouldn't be undervalued or underlooked. The person that's cleaning the rooms when you are done with a consult or done with a surgery should be given the same amount of respect as the person who's doing the consult or doing the surgery, because they're providing a key element of keeping that space space clean and tidy for you to work in. It shouldn't be that they don't have a medical degree, so they're not really here. You know, they're just doing their, should be a, you know, provide some gratitude and to make sure that they feel like they're a part of this team, because they are. Effective teamwork and collaboration is key to problem solving, especially within medicine. You know, there's been several times in my life where I've been struggling to figure something out, and I consult some of my friends and we figure out almost immediately. And I would have been banging my head against a brick wall for the next 3 months if I tried to do it alone. All right, so when you really collaborate and you invite others into the problem-solving space, it can make things a lot easier. In the case of medicine, it's making sure patients are getting healthier quicker, they're recovering, they're, you know, living the best life they can live. And so this is a huge part to that. And then everyone should have a shared part in success. Because that's huge. You know, being able to say that you're a part of a team that provided a positive impact to someone else's life, saying that you provided a pivotal role, I think that's really important because it builds up that optimism. It you know, promotes this fantastic positive environment and it pushes people to be better people at the end of the day. If you're surrounded by good people who bring up good people, more than likely you're going to be a good person at the end of it. So again, this is pretty much the end of my slide. I wanted to share one quote that really affected the way I thought about life. I was a martial arts instructor a couple of years ago, and he would always preach that people will forget what you told them. They'll forget what you did, but they'll never ever forget how you made them feel. And that's really important because I think every single person here listening can pinpoint a time in their life where they were treated or mistreated, and they remember that very vividly. And then on the flip side, they also probably have fond memories of people who treated them fantastically or really well. And so it's important to remember that you can have that same impact, negative or positive, on other people's lives. So that was something that stuck with me, and it's something that's really changed the way I operate. So I just wanted to share that with everyone. And this is the last slide. I've attached some socials here. My Instagram is here, my LinkedIn, and then my email. If you have any questions now, or maybe you have questions later on that you didn't get to ask or you didn't think of now, I'm happy to talk and collaborate with you in the future. So yeah, that's my presentation. I want to thank Dr. Gattas. I want to thank Dr. Omar. I want to thank Juan for helping me through this experience and inviting me to the stage. It's been an incredible one. This has been a ton of fun. So I'm happy to be here. Thank you so much, guys.
Thank you, Kaiden. That was incredible.
Thank you so much, Kaiden. That was a fantastic presentation.
So everybody that's here, I want
welcome.
you to take a look at his slide there, and make sure you take down his social media information there. Reach out to him. Kaiden's a really cool person. Good to know. Especially if anybody there is thinking about going to medical school or going into healthcare at all. He's definitely a very big resource of information.
Of course, yeah, and if anyone knows of anyone who's pre-med or you know, in an undergraduate setting where they're trying to pursue a healthcare field within sports medicine, you think OAM might be something they want to either get involved with if it's at a school, or if it's somewhere that they even want to pioneer at their own institution, please reach out to me via email, and I can try and get them set up, because this is something I want to keep, you know, expanding to different frontiers. And you know, Florida is on its way, and I want to expand out further. So if you know anyone, please let them know. It's a fantastic experience.
Before everybody signs off, I just want to say, you know, we've been doing this for, you know, about 8 weeks now, and I'm starting to recognize a lot of names here. But one thing that's frustrating about Spatial is that I have no way of getting a hold of you guys. Like Nicola, David, No Rely, Sophia, Juan Granja. Like I recognize you guys week after week. And so, you know, I'd love to get to know you folks. If you want to reach out to us on Instagram, LinkedIn, Discord, Facebook, we have a lot of different avenues of communication. We have a website that's up and running now. Please reach out to us. Let us know who you are, because I'd love to, you know, start really building this community that we're trying to work on.
Absolutely, guys. We have a very open door policy, so feel free to DM us, comment on any of our posts, and we'd love to stay in touch. Well, thank you guys again for a wonderful Thursday evening. We really do have a blast doing this. It's honestly really fun looking up with you guys in the metaverse and getting away from Tampa for a little while. We'll be here next week, and we hope to see you guys as well. Have a good night.